Good morning and welcome, everyone. I'm Dr. Despina Kaishan, the Chief Medical Officer at Venice Family Clinic. Thank you for joining us for our Health and Justice series. We created the series to have a forum where we discuss all the ways that health intersects our society and why it is critical that we understand the injustice that stands in the way of everyone having access to healthcare. As a physician, I am committed to caring for every patient I see. As the Chief Medical Officer of a community health center that serves nearly 28,000 people, my commitment goes beyond treating disease to preventing illness in our vulnerable population. This is the importance of public health. It has never been more obvious than now. COVID-19 and its spread has shown how we're all connected and why we must ensure that everyone has access to care. At Venice Family Clinic, our low-income patients face unique challenges that require vital resources. These resources not only include medical care, but also shelter for our neighbors experiencing homelessness and healthy food for people who face food insecurity. The Los Angeles Department of Public Health is a partner in our programs, and this partnership has been most valuable during the unprecedented times of the COVID pandemic. I and other clinical leaders access the Department of Public Health website almost daily. Throughout the pandemic, I leaned on their guidelines for our clinical protocols, testing strategies, patient education material, and so much more. We review their dashboard in our clinic meetings to determine whether it is safe for our patient to come to see us in person or stay sheltered at home, connecting to us via telehealth. We have also used the dashboard to inform our staff on the state of community spread, so they in turn can educate our patients and educate their own families. I found them to be our compass during uncertain times. Which is why I am pleased to introduce the Director of Los Angeles County Department of Public Health, Dr. Barbara Ferrer. Dr. Ferrer has been an unwavering force and champion of public health during the COVID crisis. Dr. Ferrer will be interviewed by award-winning journalist, author, executive producer, and host of This Is Life on CNN, Lisa Ling. Venice Family Clinic is honored to have both Lisa Ling and Dr. Ferrer in discussion today. It is now my pleasure to hand things over to you, Lisa.
Thank you so much, Dr. Kietjian. First of all, I want to thank the Venice Family Clinic for inviting me to be part of this event. I actually know quite a number of people who have received services from the clinic, and they have said nothing but glowing things about their experiences and how respectfully they were treated. Some of these people are ones who would have otherwise really struggled with accessing healthcare. So thank you for that. And Dr. Ferrer, it is such a pleasure to meet you in this forum. I have probably watched you and the governor and the mayor more than anyone on television this year. And you have just really guided this county through something that none of us ever thought that we would ever experience. As we all know, Los Angeles County is one of the biggest in the nation. And the state of California had quite a bit of success in the beginning, but then got hit immensely hard in the summer. And now as the virus is surging and overwhelming hospitals in many states, cases have come down here, as have hospitalizations, although I just saw that there's been a jump in recent days. But to what do you attribute the downward trajectory, and what would you say we need to do to keep it trending downward and maintaining?
Yeah, thank you so much, Lisa. And first, I want to really not just thank you for being with us today. I'm so honored to actually have a chance to meet you as well. But I want to thank you for all the work you're doing to make sure that everyone has really good information. There's no way for public health departments to be able to communicate with the vast numbers of people that really need access to good information. It's pretty hard to ask people to change their behavior if they're not really able to understand why. You know, what's the science behind it? What are the issues that we're all facing? And I want to commend you and your colleagues in the media for doing such a good job over many months, 9 months now, presenting accurate information. I also want to thank Despina and all of the folks, our wonderful friends and partners at the Venice Family Clinic. For all of you getting your medical care from the clinic, you have the best doctors providing you with support, along with all of the staff that make up the wonderful Venice Family Clinic family. I particularly want to thank and acknowledge Dr. King. He has been our partner on outreach amongst the thousands and thousands of people that are experiencing homelessness across the county, and a real leader in making sure that we're a good partner in bringing services to some of the people who are unfortunately the most vulnerable, not just now through a pandemic, but every single day. So thank you all for having me here. And yes, this is a new virus. And I think because it's a new virus, the biggest challenge has been figuring out exactly what works to drive down community transmission, and then what actually contributes to increases in community transmission. When I like to look back, I think that the best piece of news that we have is that as a county, we've come together twice now and been extraordinarily successful in slowing the spread. We came together initially, and as you noted, Lisa, did not see in the early days of the pandemic huge numbers of cases. People stayed at home. We have ample data that demonstrates that when people stayed at home, they really avoided connecting with people outside of their households. The exceptions were our essential workers, and we owe them a debt of gratitude because they actually are disproportionately now affected by the virus because of their service. But all in all, people did the right thing. And the second time was after we saw a huge surge, cases topping well over 3,000 a day, hospitals really reaching the brink with serving 2,200 patients a day. And everyone again came together, did at that point what we knew was the right thing, which is all about wearing those face coverings, keeping our distance, avoiding crowded situations, full compliance at the business sectors that are reopening, full compliance, protecting our workers every which way we can, because that has to be center in this, and really addressing the fact that there had been a disproportionate impact around cases, hospitalizations, and deaths in communities of color and those communities with less resources. But we did it. We came together. I want to say at the beginning of September, we went from 3,000 cases a day to 900 cases a day. And that doesn't happen because one or two people, are doing the right thing. That only happens because hundreds and thousands and hundreds of thousands of people are doing the right things. And all of our business leaders, our union partners, and our workers are working together to create safe environments at every sector that's reopened. But unfortunately, as you noted, we know what it is that we need to do to bring down the case numbers and to reduce community transmission, but it's hard for us to keep doing it. And I think it's really unfortunate. We have another very serious increase that's happened over the last 2 weeks. And again, we're back to, asking everyone, businesses and individuals, you know what the right thing is to do. It's pretty hard to do it consistently, but unless we do get back to slowing the spread, we will again lose the progress we've made on the recovery journey and may in fact be forced to take some steps backwards.
And Dr. Ferrer, do you believe that the recent uptick is because people have just started getting lax in abiding by the guidelines?
Yeah, I think it's such a good question. I mean, I think, I'm like everybody else. I feel the same feeling of relief when our numbers go down. And then the same anxiety, I think, when the numbers go up. And I know that even myself, and, I'm certainly have a lot of good information. When the numbers go way down, you tend to think, okay, there's not so much transmission. So, I haven't been to the bookstore since February, so I'm going to go to the bookstore. I mean, I think for each of us, we look at the lower numbers and we say, I can now step out more. I can now do some things I wasn't doing before. And the problem is that's a slippery slope. And sometimes what it's resulted in, unfortunately, and we've seen a lot of this, is people gathering with people not in their household, not wearing their masks, not keeping their distance, inside, oftentimes cheering on our wonderful LA teams, and a lot of spread. This virus doesn't care about whether the case numbers are low or high. This virus is relentless in being easily passed on to other people. And in those environments where we do let down our guard, particularly when we feel like, I know everybody here. Like everybody here, these are my friends, these are my extended family. I can feel safe here. The problem is 50% of the people probably that are spreading the virus have no symptoms. And they themselves may have taken a lot of precautions and still gotten infected. I mean, we had great examples, even when people were being tested every day, every other day. That did not prevent people from getting infected, and it did not prevent those infected people from passing on the virus. Keeping our distance, wearing our masks, those are the tools, washing our hands, those are the tools that are going to work, but it is hard to keep it up. But we're going to need to.
We are continuing to prolong this crisis ourselves when we get lax and don't strictly adhere to the guidelines. Everyone is fatigued. I mean, I can't even imagine your workload at the department. You mentioned the disproportionate effect that COVID has had on communities of color. Have things gotten any better in those communities here in LA, you know, as we're 8 months into this crisis? And what more needs to be done to protect these communities?
It's such a good question. And, you know, I'm going to report on data that we looked at 2 weeks ago. We'll look at it again next week. And I'm hoping with the surge in cases, we don't see a widening of the gaps. We've actually significantly narrowed the gaps. You know, back in July, our Latinx, Latino populations, our African-American, Black populations, Native Hawaiians, Pacific Islanders were, you know, between 2 and 4 times more likely to be infected with COVID-19, 2 to 4 times more likely to actually be hospitalized, and unfortunately, 2 to 4 times more likely, and in some cases 5 times more likely to die. The same thing applies for people living in communities with high rates of poverty and few resources that promote health. And there the gap was even wider. There the gap has been consistently at least 4 times, sometimes 5 times, 6 times the difference between people living in communities with higher rates of poverty and people living in communities with lots of wealth. The good news is since July, we've narrowed those gaps, you know, across the board. And as a matter of fact, for African Americans, which started with some of the highest mortality rates, their mortality rate a couple of weeks ago was one of the lowest mortality rates. I think we still see a significant amount of disproportionality between the Latinx, Latino communities compared to others, but even that has dropped to, instead of it being 4 times the rate of other communities, it's down to 2 times the rate of other communities. And obviously, you know, the gaps need to disappear in order for us to feel good about the work we're doing. But when the gaps start narrowing, you know that some of your efforts are making a lot of sense and having an appropriate impact. And I think you asked the right question, you know, what do we need to do to eliminate the gaps? The first thing I want to note is these are historic gaps in outcomes. They're not just for COVID-19. It's a horrible part of our reality to see this play out in front of us every single day now as we so closely track one disease. But if you look across at all of the diseases we track over time, you will see enormous disproportionality in the impact of disease among communities of color and people with less resources. And the root cause of that is really related to racism and the impact of racism on preventing people from having opportunities and resources that are absolutely essential for good health. And I say that because I think oftentimes when people see the disproportionality, they're so quick to blame the very people who have the worst outcomes, as if it's something that an individual can completely control. And we know that's absolutely not true. It's not true around heart disease. It's not true around diabetes. And it's definitely not true for COVID-19. Yes, we all have a responsibility to manage our individual behavior so that we reduce risk. But for example, our essential workers are disproportionately people of color and people with lower wages. And they never left their job sites. And when you talk about January, February, March, and April, we had no idea how this virus was really being spread. People were not wearing face coverings. People were not keeping their distance. And we knew nothing about asymptomatic spread. As a matter of fact, I'm one of the people who stood up day after day saying, yes, it's possible that there's asymptomatic spread, but we've never had a pandemic that's been spread by people who don't have symptoms. So let's worry about people who had symptoms. And all of our systems were in place to sort of really weed out people who were sick. Well, that did not protect our essential workers. So from the very beginning, those people who worked as our grocery clerks, they worked in our businesses, they are our people who are custodians, they drive our buses and our trains. Those were the people who had very little protection. And in fact, the virus got quickly rooted in those communities. People all go from work back into their communities and neighborhoods, and then oftentimes back home. And we saw a very quick spread. And we're still working on what I think is essential, protecting our workers, particularly those workers who don't have options to telework, and in fact can be in situations that are crowded with lots of contact with other people. We know what's going to work to protect them, but we have to make sure that businesses understand that they're legally obligated to protect those workers. So that's been our strategy number one, worker protections. All of our health officer orders are legally binding. We don't make recommendations about what needs to happen in a workplace. We require you, if you are open, to protect your workers and your customers. And we tell you exactly what it's going to take to do that. And then we expect very high compliance. The second thing is making sure that people have good access to testing and also to care. So if you already know that the people who are having are the hardest hit are also the very same people who have more underlying health conditions, it's not enough to just note that. We have to make sure that people are well connected to care so that if they do become infected, there's not a long gap between the time they find out that they're infected and the time that they have care from a provider. And again, I want to call out the Venice Family Clinic because they've made it very easy for their patients to get care throughout the pandemic, either through telemedicine or for those who needed it for in-person visits. But everyone doesn't have a Venice Family Clinic. And our job is to make sure that we connect all people with care before they're infected, so that if they should become infected or have an exposure, they have trusted people that will help them making sure that they have the best possible outcome. And then testing. You know, at the very beginning of this pandemic, if you tracked who was getting tested, disproportionately people who were white and people who were living in our communities with more resources. I want to thank all of the hundreds of partners that we had to increase testing, particularly the Department of Health Services. So now we've actually flipped that. The highest testing rates are in our communities that are the hardest hit. And that's right, because if you're in a community with high rates of transmission, more people are going to need to get tested because there likely are more exposures. And then I think the last piece is we need to work more closely with trusted community partners during the pandemic and really all of the time. And when I say working closely, I don't mean having a Zoom meeting. I mean making sure that resources are getting to trusted community partners. People may not listen to me, but they're probably going to listen if they're a person of faith to their faith leader. They're probably going to listen if they get services at a federally qualified health center or through a provider. They're probably going to listen to those providers. If they go and get social support from some agencies that really help them with food insecurity issues, housing issues, then those are the very agencies that need to get resources from all of us so that they can continue their work as trusted leaders in the community, helping to make sure that when we ask people to quarantine and isolate, we acknowledge that it takes money to quarantine and isolate. So we either need to provide people with a place where they can do that, or we need to make sure they get resources in their homes. And that's, one of our efforts right now is to actually partner with community organizations, making sure that they get resources to help the people that they're servicing and supporting as well. Long answer, sorry.
Oh, no, that's okay. It's interesting you mentioned that people need a place to be able to quarantine. In many low-income communities where multiple people are living in a small dwelling, if someone does test positive, there aren't places to go. I look at countries like Taiwan and Korea, where they have this system in place where the moment you test positive, you don't go home, you go straight to quarantine so that you don't infect people in your family. Now that we're 8 months into this, are there conversations about having those kinds of places? Because as we embark on those winter months, we may need those kinds of places.
So we do, actually. We do have quarantine and isolation facilities in the county. And I know that Venice Family Clinic and Dr. King have actually changed their process when they're doing their street outreach and referred particularly people experiencing homelessness, because it's impossible to quarantine if you're living on the street. So we do work hard to make sure that people who are either infected or close contacts of people who are infected, who are experiencing homelessness, are referred to a quarantine and isolation facility. These are often hotels where people can go, and we have support services. So you're going to go, you're going to get your meals, but you can stay there for the full isolation period and the full quarantine period. Those are also available for people in the community who, just as you said, cannot appropriately quarantine or isolate in their homes because their homes are crowded. I do recognize that for many people, they don't really like the idea of going to a quarantine and isolation facility. And we're working hard to have additional options to support families where that actually is a necessity, and it would be too hard for it to happen in their usual housing location. But this is a county that actually is very committed to making sure that families do have a place to isolate and quarantine. We've also asked the state for help. There's a wonderful program for our healthcare workers who have exposures and don't want to go home and expose their family. And we're looking to expand that program as well to just people who live in hard-hit communities.
That's great to know that those places do exist. I want to continue talking about homelessness because frankly, it is a public health crisis on top of a public health crisis. It was believed that LA County was going to suffer exponentially because of its massive homeless population, but COVID hasn't really had the kind of impact that we thought it would in those communities. But do you think that will change as winter approaches?
I'm very cautious now about pretending I have a crystal ball at all with this virus, because so much new information has come along and it's made it particularly hard to project accurately out more than a few weeks. But I will say that I think the fact that we haven't seen COVID-19 devastate people experiencing homelessness is not by chance. There have been extraordinary efforts that have been made from day one of the pandemic here in LA County to protect people experiencing homelessness. In March, we actually had a team of our inspectors go to every single interim housing facility, including all the shelters, to prepare them for the possibility of having cases and outbreaks within their facilities, and to make sure that they were actually on top of infection control before they saw those cases, making adjustments in the sleeping arrangements, making sure everyone had ability, if you were a shelter, to isolate and quarantine, at this point we still thought symptoms were the driving force, so doing a lot of symptoms checks, and now flipping and adding to that, doing a lot more testing. The same thing with street outreach teams. They have been out since day one for people who don't want to go inside, trying to explain to them how to keep themselves as safe as possible, but really making an amazing effort to find vulnerable people who are experiencing homelessness and unsheltered and move them into living spaces that were individualized through Project Room Key. So thousands of people got moved from living unsheltered into a safe environment where just one person was. So these are people who had a lot of underlying health conditions and would make them very vulnerable to serious illness should they become infected. And they were actually prioritized. Again, many of these were hotel and motel rooms where they were actually able to be by themselves. So I think a combination, we have an entire sort of system set up where providers can call in their cases and get referrals to isolation and quarantine sites for people experiencing homelessness, and all of the efforts made by the street outreach teams. I want to again commend the Venice Family Clinic, Dr. King, their street outreach workers, because they've been at the forefront of understanding, people experiencing homelessness have a right to make choices for themselves that they think are in their best interest, but we have to give them choices. And during the pandemic, that means, particularly for those most vulnerable, the choice to stay sheltered somewhere that's going to be safe. For those that are comfortable in our shelters, making sure that our shelters are appropriately resourced, getting masks to the shelters. I mean, initially, these were the big tasks, making sure people experiencing homelessness have their face coverings and understand why they need to use them, but that staff are protected as well. So I think that's why we didn't have a huge surge. I don't think it was happenstance. I think people put a lot of effort into extending themselves and their services. But you're right. Now we're going into another winter. And again, people are very vulnerable that are staying out and not sheltered. And we need to prepare again our interim housing facilities for welcoming everyone who wants to come in, but doing so in as safe a manner as possible.
That's such a great point that you make. I mean, we can't pretend that it just happened. There have been so many people working tirelessly to try to prevent these things from happening, like the Venice Family Clinic. I mean, on that note, can you talk about specific ways that the Department of Public Health has partnered with the Venice Family Clinic?
Sure. I mean, I think one, because the Venice Family Clinic is what I call, sort of the best model of, comprehensive integrated care. One of the efforts that we have now with the clinic is that they have a grant from us through our CalFresh Healthy Living program. I think it's $660,000 over the next couple of years that really allows the clinic to continue their fresh food giveaways. I mean, COVID, during times of COVID, but in all times, we have so much food insecurity. And the fact that the Venice Family Clinic can help people that live in their community with, healthy food that allows them to not go hungry, but also have access to the things that help you be healthy by eating well, I think is, again, tremendous effort on the part of the Venice Family Clinic. And we're happy to play a small part in supporting that program. We also partner with their life safety teams, providing medical services in the hotspot areas. And again, I think here we benefit more than the Venice Family Clinic from that partnership, in part because I think you have some of our most skilled, compassionate providers at the Venice Family Clinic, teaching all the rest of us and our provider groups how to best do our work. I know that we also are co-located. We have some of our staff co-located, I think, at the clinic's Sims Mann building on Pico. And again, this is so that, we really try to support the Venice Family Clinic. In some ways, I feel like flipping your question and saying, how are they supporting us? Because, we benefit so much from their ability to be very close to the people who need help and resources the most. But I know, our commitment continues on really supporting the street outreach teams, making sure that we're doing our part and then being as helpful as we can with small grants that allow the Venice Family Clinic to continue playing a leadership role in providing comprehensive services and support to families in their community.
Dr. Ferrer, are there any circumstances under which another lockdown could be necessary?
Yeah. I mean, I will never take anything off the table again. I mean, one lesson we've learned is there's a lot of, inability to predict exactly what's going to happen next. So, yes, we could get to a desperate, and I use the word desperate because that's what we'd have to be. We could get to a desperate place where lockdown is all that's left. Because again, skyrocketing cases results in significant increases in hospitalizations, and significant increases in hospitalizations this upcoming fall and winter, when we also know that we could have a lot of flu circulating, means the very possible potential for overwhelming the healthcare system. I mean, sometimes people, aren't really clear what I mean by overwhelming the healthcare system, but that means that it's not just COVID-19 patients that aren't going to get care. It's people with heart attacks. It's people who have serious injuries. It's people who need life-saving surgeries that also don't get care. So it's not just people with COVID that suffer when the healthcare system gets overwhelmed. It's all of us that suffer. So for those people who, really aren't worried about this because they basically say to themselves, well, I'm never going to get really sick from COVID. I'm in that 80% that, is definitely going to do well, which I'd actually say, you don't know for sure which percent you're in. We've had a lot of young, healthy people get very, very sick. But even if you continue to tell yourself that story, you have no idea that you're not going to be in a car accident. You have no idea that you or someone you love dearly isn't going to need urgent hospital care. And that care can get compromised if we overwhelm the healthcare system. So we ask everyone to understand that we cannot, as a community, allow that to happen. And should we see ourselves heading for an overwhelmed healthcare system, I think the reality of shutting everything down becomes a greater possibility.
Yeah, I mean, that is really what I try to remind people, that when hospitals are overwhelmed, if you have an emergency, you are not going to be able to get treated if the hospitals are filled with COVID patients. This is where the crisis really, this is where the potential for crisis really exists. And people just somehow just don't get it. In fact, at the highest levels of government, there has just been this abject denial of the severity of this virus and also of the science. So how has that affected what you do and how people are reacting to measures that are intended to protect the public?
Yeah, I think that is the hardest challenge for all of us who work in the communities where we are in service of the people who live across LA County. And we actually want to do our best to ensure that everyone stays healthy. It's really extraordinarily difficult for me to tell people how important it is to isolate and quarantine, and have examples over and over and over again at the very highest levels in our government of people who don't isolate and quarantine. So if you think that our leaders don't need to isolate from everyone else for 10 days plus being symptom-free for at least 24 hours, fever-free for at least 24 hours, and I ask you to isolate and you have no symptoms, you're looking at me like I'm crazy. And if you see that there were dozens and dozens of people exposed to somebody who was positive for COVID-19, who the very next day get out and go to a rally saying they're an essential worker and that it's fine for them to go to a rally where they're going to be in contact with other people and potentially able to spread, When I ask you, or our health officer asks you to please stay home and quarantine because you had an exposure and you were a close contact, people look at us like, what are we saying? There can't be two standards here. It's either the right practice for all of us, or it's very easy for people to think it's not the right practice at all. And I know the science tells us conclusively, like there's no questions about this, that if you're infected, you have to stay out of circulation for at least 10 days, even if you have no symptoms. And if you've been a close contact, the incubation period is 14 days. And that means you can get infected anytime during the 14 days, even if your test is negative. And you're on day 3, day 4, day 5, day 6, you can become infected because it's 14 days that the virus has before it may in fact be able to show up in your body enough so that you would test positive. It's so hard for people to understand and believe us if they don't see others modeling that behavior. And so, our plea is, I know it's hard to isolate, I know it's hard to quarantine, but if you're asked to do so, it's really in your best interest not to be a spreader. I like to say that if you're a spreader, you are the problem. We all want to be part of the solution, and we all have an opportunity here to save lives. And that's how we need to move forward.
Yeah, I mean, I continue to just say that it didn't have to be this way, right? I mean, if we had just as a country acknowledged the severity of this virus and what we had to do, we would not be 8 months into this, surging in so many parts of this country, and for so many of us not able to send our kids back to school at this point, when so many other countries in the world have followed the guidelines and have not even shut down their economies, frankly. They followed what they were supposed to do. I want to ask you about.
I just wanted to say one thing, because unfortunately, sort of mask wearing turned to be sort of
politicized,
politicized, but and tied into American values, like our value to have freedom and freedom of choice. Really became sort of the rallying cry for why people don't have to wear a mask. And I like to think that the most important American value we bring collectively to our communities is this value of caring for each other. And that's what wearing the mask stands for. That's the American value I grew up understanding, that we care for each other, that we take care of each other. And wearing a mask, that's what you're doing. It's not about you. You wear that mask for other people. You wear that mask to show your respect, your compassion, your caring for those that are around you. And I don't know how it got switched, because when I think of what we all hold dear, it's our capacity to care for each other. And that's what mask wearing should represent. It doesn't matter if you're a Democrat or a Republican or an independent. If you're a person who cares, you should wear a mask. Period. That's our American value.
It really is such a minor inconvenience in the grand scheme of things. I mean, look what happened with seatbelts, right? Seatbelts have saved lives. Well,
yeah.
Now, I mean, studies have shown the foremost scientists in the world have indicated that hundreds of thousands of lives could be saved in the world if people just abided by wearing masks and social distancing. I want to ask you about a vaccine.
Sure.
Given also the vaccine hesitancy that exists in this country, what do you think the future will look like when a vaccine does become available?
Yeah, I think it's such a good question. So, of course, we have a large team here now working on, both figuring out how to distribute vaccine. There'll be cold chain requirements. We come at this work always with an equity lens, but part of that equity lens is understanding the tragic history we've had in this country around, not really respecting the rights of people and using sort of testing, our testing new advances without protecting the rights of people. And really, that has hit hard in communities of color. I mean, I come from Puerto Rico where, birth control, many people don't know this, but in the early 60s, birth control pills were tested. That contraceptive method was tested in Puerto Rico amongst women who had no idea what the risks were not really given a lot of choice. And many of them ended up very sick and in fact ended up losing their ability, their reproductive abilities. And there were no protections. So I witnessed firsthand in the community I lived in the tragedy of having companies make decisions around how they're going to do their trials without respecting the fact that all people need to be voluntarily participating, and there has to be full disclosure of risk. And you then have to provide them with resources should there be adverse outcomes, if people are part of clinical trials. And then we have Tuskegee in this country. I mean, we have example after example where people's rights were violated at great cost and at great harm. So some of the work in front of us right now is to listen in communities that have been hardest hit about what they would like to see in order to feel comfortable with a vaccine, and then try to make sure that those conditions exist. I think everyone will be hesitant around getting vaccinated until there's safety and efficacy that's established. But I think beyond that, in some communities, there are other barriers to people feeling comfortable about getting vaccinated with a relatively new vaccine. And what we need to do now is listen and understand what that is without judgment. Because our job really is not to judge what you're bringing to an experience and your desires for how you want to be treated, but to understand that so that we can then make ourselves available either with better information, different kinds of opportunities to get vaccinated, or just acknowledging that in some of our communities, it may take longer for people to feel comfortable with a new vaccine, and then working super hard to make sure that all the rest of the tools in our toolbox are available so that we continue to reduce the spread.
Dr. Ferrer, I want to take a moment to ask some of the questions that are coming in.
Yes.
Someone is asking, now that so many studies have come out showing that schools, particularly elementary schools, are not super spreaders, what is the plan to continue opening schools beyond the current 25%? And how are schools prioritized relative to the opening of salons, indoor restaurant operations, et cetera?
Yeah, that's such a good question. So this is a little bit complicated in the response because people assume as a county that we're able to make all of the decisions about what opens and what doesn't open, and that's actually not accurate. The state actually is the first place where those decisions are made, and everybody in the entire state is subject to state health officer orders. And the state has created a tiered system. And there's 4 tiers. The lowest tier, tier 1, is where there's the most community transmission. And then counties work their way up to tier 4, where there's minimal community transmission. And your options for reopening are set by the state depending on what tier you're in. And what tier you're in depends on how much community transmission you have. LA County is one of a handful of counties that still has widespread community transmission. As a matter of fact, our rates went up this week. And therefore we remain in tier 1. And our options for reopening schools in tier 1 are limited to the following. We can bring back students of high need at all schools up to 25% of the total student body. We can offer a waiver program for students in grades TK through grade 6. And that's an application process. So you actually have to apply to the local health department and get an approval before you can reopen. And then of course, daycare that's licensed or has a waiver from the state can be in your school buildings. And teachers and staff can also be in your school buildings to provide distance learning or to make sure essential operations continue. But that's what we're allowed to do in tier 1. So we cannot return all our students to schools while we're in tier 1. So the main priority right now, lower our community transmission rate so we get to tier 2, because when we get to tier 2, we have many more options. But I also want to note there's 1.4 million students in LA County just in our public school system, and probably an additional 200,000, maybe even more in the private and parochial and charter school systems. So we have probably almost 2 million students looking for opportunities to have an excellent and high quality education. For some of those students and those families, that opportunity during a pandemic will always need to be through virtual learning. So I want to commend all of the school districts for actually doing their very best to create a virtual learning platforms that work for many families. I also want to note that it's super important for high needs students to be able to get back to their buildings now, and commend all of the schools that are open. We have probably 1,200 schools open in the county at this moment serving high needs students. But part of the reopening plan really has to be the focus on creating as much safety as possible at the schools. No schools can reopen in LA County that don't adhere to our requirements for safety, which really cover infection control, distancing, masking, and now, while we're in tier 1, cohorting, stable groups of young people and supervising adults that do not intermix with other groups on the campus. We also have a team of about 100 people that are out supporting at the department, that are out supporting schools that are reopening. This is the only sector where we will inspect every single school that's reopened. And we will provide technical assistance to every school that's reopened. And when there are cases at every school, which there will be, or at any school, which there will be, because we have a lot of community transmission, we have a dedicated team just to schools to help with case and outbreak management. But everyone who's open has an outbreak management plan. And everyone knows how to get hold of our team should they start seeing cases, because what we're trying to do is put in place practices at schools that prevent a lot of transmission at schools. What you don't want to do when you reopen your schools is create another place where there can be a lot of transmission. And, I know people, still believe that, younger students in particular, they don't get infected. That's a myth. We have over 35,000, I think, people under the age of 18 that have been infected in LA County. And we have hundreds and hundreds of kids that are hospitalized. And we have example after example where kids infect other kids and kids infect adults. We don't exactly know what that rate of transmission looks like from children to children and children to adults. But it's a myth to think that they are not capable of transmitting. They absolutely do transmit, and they absolutely get infected. So our job in a school setting is to protect children, teachers and staff, and then all of their families from having schools become sites of large outbreaks. So we put together these safety protocols. What we're doing now is making sure that it works, because we already have cases in many of the schools that are opening, or in some of the schools that are opening. What we have to prevent is these large outbreaks. And so far, we're doing a really good job. We don't have any large outbreaks. But that's thanks to all the work that the schools are doing, all the work that the parents are doing, all the work that the children are doing, and all the work that the teachers and staff do. There's a community, and everyone has to make good choices, not just while they're in school, but then when they go home.
We have a couple of questions around mental health. There's someone who's saying that they have a 14-year-old who's having a really hard time. Are there ways to support him through this? And there's another question about parents who are trying to juggle their jobs and monitor their kids while they're distance learning. Any thoughts or words of support that you can offer them?
I mean, the first thing is, my heart goes out to everyone. I actually don't know that there's anybody who's not anxious, hasn't experienced depression, confusion, and a fear around this virus. And for those of you who are in fact juggling parenting, being a quasi teacher now and trying to do your jobs, you're put in really one of the most difficult and challenging situations. I mean, one thing I want to note is that the county has a lot of resources available through the Department of Mental Health, including, sort of just easy ways to talk to folks. So sometimes we just need to talk about our feelings. We're not mentally ill. We don't need 100 therapy sessions. We just need the ability to talk. And we also need the ability to get some tools to help us manage our stress, because I think we're all stressed. And so I urge you to go to the Department of Mental Health's website here in the county and look for those resources, and then avail yourself of those resources. And the same thing for your children. I think there's a big difference between children experiencing some anxiety and feeling blue, between children that really seriously are doing poorly during this time. And for children who are doing poorly, I ask you to connect with your provider, and perhaps they'll help you connect to all the kinds of services that are available to really support children during this very difficult time. And then, I do want to note that some of the options that are open that we're hoping schools are taking advantage of, and we know that communities are taking advantage of, is we've opened a lot of opportunities for youth sports. And this is really, at this point, we're in tier 1. It's just for conditioning, and it's skill building. So no competitions are allowed. But youth sports has been very broadly defined in our county, and it includes a whole host of activities. So check in your county and check with your school to see whether or not they're offering these activities. They're outside, but they are supported by adult supervision. They are distant, and people all need to wear their face coverings, but they do allow for supervised and relatively safe social interactions amongst young people. And I know that for some of us with young people, they're missing their peers, and trying to create opportunities where it's safe for peers to actually get together means looking at some of the things that communities are doing, under the rubric of youth sports. And our hope is also that schools have really expanded that definition of high need. It's not meant to just cover students with individualized education plans, English learners, students needing assessments. It really was meant to say that a school has flexibility to say, there are a group of kids that really, they need to come in for their advisory, or they need to come in, to get support with their distance learning, or they need to come in for emotional well-being and skill building around, building their coping skills. And those are all appropriate, students to bring in right now into the school buildings for services and support. But I do want to say, please make use of the strategies that are out there for you to use, for you to get to know. There's a lot of sort of mindfulness activities. There's a lot of online stress reducing activities, and take care of yourselves. It's hard to take care of your kids if you can't take care of yourself. So please, figure out what it is that you need to do to get more centered, because we have a ways to go in this pandemic.
Well, Dr. Ferrer, we are almost out of time. I just have one more question for you, and that is, how are you? I mean, you've been guiding one of the biggest counties in this nation through this unprecedented global pandemic. I mean, you've always had this lifelong passion for social justice and helping people who have a hard time helping themselves. But ultimately, how are you handling this, especially as we embark upon these winter months?
First off, I want to say I'm extraordinarily blessed and thankful for being so blessed. And one of the biggest blessings I have is my staff. Our staff here at the Department of Public Health are amazing. I am part of an extensive, extraordinary team, and I couldn't do this work without that team. And it extends, far and wide, that team. I have my colleagues here at the Department of Public Health who are both gifted and skilled and keep us all focused. I have a wonderful board of supervisors that I work for that also, through their leadership, and kindness and compassion, I think, have allowed us to move forward with what's most important, which is strategies that are value-based, understanding at the very basic level the need to pay attention to equity, compassion, kindness, as we move through this together. And I have a wonderful family, so I'm blessed and I'm thankful, and I think that there are a lot, and I have a job. So all the economic insecurity that so many people face, the devastation that so many people face, it's heartbreaking. To all those who have lost their loved ones, heartbreaking. And so, I'm in the group that actually says every day when I get up, how blessed I am, and how my job really is to try to make sure that other people have what they need to get through this pandemic.
Well, Dr. Ferrer, it goes without saying that we appreciate you taking the time to be with us today. And we are so lucky to have someone who is so passionate, shepherding us through this crisis. I can't even imagine what your days are looking like. I can't imagine what your staff has been going through. And also, to everyone who works for the Venice Family Clinic, everyone who supports the Venice Family Clinic. We as we talked about a little while ago, one of the reasons why we've had some success at this is there's so many people working behind the scenes and tirelessly to help try to keep people safe and try to prevent community spread. And so many of these people work for the two organizations that we've been talking about here today. So I want to thank Dr. Ferrer for taking the time to be with us. And to those of you who are watching, thank you for taking the time out of your day. And if you have any interest in supporting the Venice Family Clinic, there is a link in the chat where you can do so. And I encourage you to take the time to find out what they are about, because as I said when we first started this, I've had friends who would have otherwise probably not been able to access service, but just got such extraordinary care from people who really do care at the Venice Family Clinic. So thank you all. Be safe today, wear your mask, follow the guidelines, social distance, and have a great day, and have a safe Halloween.
Thank you, Lisa.
Thanks, Dr. Ferrer.